So when I first presented yesterday morning, it was about the context for sustainability. And now here we are. The weekend went very, very fast. So I wanted to put this question back up there for you. I think you have many great ideas that you developed here over the weekend or heard about through our speakers. But this is your chance to really be leaders in this field and to move forward and to really change your environmental footprints and to be leaders across the world. Part of the reason that I came here to Aravind was because they're great leaders, and these are things that we need to take back to the U.S. to become more efficient. And so this is all for you now. It's your opportunity to shine. So it's some things to remember from this workshop, right? We're trying to meet our needs today without compromising future generations' ability to meet their needs. This means in terms of energy and water, natural resources, carbon emissions. There's a whole range of issues that we're trying to address. And any solutions that we develop must be sustainable in terms of cost, in terms of their social capital, and in terms of the environment. So to keep that in mind as you're designing your solutions. Again, it's a systems issue, so you can't just think about one isolated problem. You have to break down the silos in your institutions and across with other collaborations to come up with solutions that are holistic, that will not run into complications because of the systems issue. So please do keep that in mind. So what's next? What are we doing moving forward? I'm sure you have lots of things written down in your booklets, lots of promises. This is one way I think that might be useful. Again, this field is new, so there's few resources, but not as many. This is the Center for Sustainable Healthcare out of the UK. They have a forum which they call iHealth Susnet. So you can join for free, and they have a few resources. You can basically talk with other healthcare professionals on this forum. And I think anytime you're working on sustainability in particular, it can be very depressing. Right? We're trying to save ourselves, and so you can get bogged down in these issues that sound overwhelming and insurmountable. So it's important to have these kinds of networks to bounce off ideas and to keep your enthusiasm and energy. That's one of the things I'm very grateful about being here for. Instead of being in my lab going through numbers and spreadsheets, I get to see how this might actually have an impact. And that really excites and energizes me for the rest of the semester at least. So thank you for that. This network, I think, is a very good one for eye health professionals in particular. Another good network, which is more global, this is through Healthcare Without Harm. So it's an international group, and it's focused on sustainability in healthcare generally. So maybe not just the clinical side, maybe not just eye care. But they have a forum as well called Global Green and Healthy Hospitals Connect. You can join for free as well. There's expert contributors and then just the forum of global users. And they pose questions to the forum. So I saw one recently that was, we're trying to remove styrofoam cups from our cafeteria. How did you implement this? And then people will respond. So it's also a great network more generically for healthcare sustainability. And of course, as I mentioned earlier, the IAPB has this sustainability work group. It's been around about a year, led by Mr. Tulsi. And we're currently hoping to upgrade the website, so hopefully it will be more than just this flat page. But we'd like to develop case studies of different institutions who have done some really amazing things with sustainability in eye health. We'd also like to develop some guidelines, and we're working on a few interesting tools and things in relation to procurement and the eye efficiency tool. So as I mentioned earlier, this is in development. It's supported by the IAPB and the Seeing is Believing Foundation, or a grant. We're working with the Center for Sustainable Healthcare and a few different locations around the world. Basically, it's a website and a cell phone app that users will input basic information about their institution, so it's more at the facility level. And the app would go into the operating theaters, and the person would click a button when the patient comes in, when the blade goes in, all these different parts of the surgery. And with all that data that we gather, we'll send back to the unit some information on their throughput, on the cost per case, the waste generation, and the carbon footprint. And more than just those numbers, we really want this tool to be somewhat comparative. So these were the pilot sites who had used the tool. And so basically every time you use this auditing tool, it's intended to be used about once a year, you can benchmark yourself from the prior year and see if you've improved things on throughput or cost or carbon footprint. And it's also intended to be compared to other users, so by geographic region or other types of comparative metrics. We'll be anonymously comparing, so you'll kind of see your ranking relative to other hospitals. And so that's the idea with this particular tool. So iFficiency. We just finished pilot testing, and we're currently working on what's called the beta test phase. So this is a little bit more intensive usage of the tool, but only by 20 sites. So we've got those sites selected. They'll be running the tool over the next year, and we'll be improving it, hopefully making it very pretty to use as well. And hopefully by 2020, it will be available for general use. And so this will be a basic tool to do some carbon footprinting in your cataract surgeries. The accuracy probably won't be there just because it has to be a little more generic, but it's a good first step at giving you some numbers to compare and to improve. And so that's one of the things that the IAPB work group has been kind of leading the way on. And we're hoping that these types of tools can be developed to really empower you all to make your services more efficient. All right, so the commitments. Those are some of the promises that I have made going forward, is to help develop these tools and things and to help share more publicly all of the problems and struggles that we're having with sustainability. For you, I'm not asking to hear your commitments, but I'm sure you've made a lot of them. I just ask that you would take this seriously and take your enthusiasm, go back to your homes and to your workplaces, and to really spread that enthusiasm. There's so much that can be done, and I think with events like this and with committed individuals like you all, we can really accomplish some great change. So thank you.